think the situation with COVID-19 was, of course, there was an immensely rapid, sudden lockdown with distancing, and then a reconfiguration of health services. What really happened within the NHS and other healthcare providers around healthcare provision was that, there has to be a sort of rapid transformation in what people were doing. So there's a postponement of routine surgery. There were reductions in sort of dedicated services, for example, for long-term conditions. And in some cases, that will have been for those people with sort of long-term painful conditions. And so, the concerns that we have are really around, what happens to those people who require these sorts of interventions and management of these long-term conditions? What happens in terms of, are they accessing treatments? What happens if there are delays to treatments? And what the concern is that if left untreated, some of these conditions will get worse and harder to manage. When we talk about chronic pain, this is a sort of a term which is used to describe a sort of multitude of sort of different conditions. And as you can imagine, sort of pain is a core component of this. Pain can be a symptom of injury, can be illness, but it can also last longer, and it becomes chronic when it lasts. It's usually defined as over 3 months. A second approach that we can sort of possibly think about are trying to think about new ways of helping people. And there's a lot of talk at the moment about moving things online. It's been, to some extent, quite a success story in that very suddenly we've managed to remove many of the barriers to managing people's health online, and we demonstrated this can be successful. But I think it's still early days, and there are other challenges, and in particular, how we actually deliver these sort of fairly complex, intensive, multidisciplinary type approaches online, and how we deliver this successfully remotely. And a third element to consider is actually access. So whilst, yes, we may be able to access a wider sort of number of people, they do have to have the technology, infrastructure, etc., to be able to use this. And so there's an access issue that we also need to be mindful of.